I'm Dr. Rodríguez-Feliz, board certified plastic surgeon. Today I'm going to take some time to talk about this particular patient, which we're going to do a preoperative evaluation here in a photo so you can see how I think when I'm evaluating a patient for eyelid surgery, and in this particular case for eyelid ptosis as well. So this patient mentioned that her right eye, which is the one on the left side of the screen, it's always been a little bit, more close down the left eye. And on the evaluation, I noticed a few things. One of them being that her her right brow is slightly lower. She also on exam had a lot of laxity of both brows. I did like the distance that she has from the lashes to the brow. That's actually a good distance. And then I also noticed that she has a little bit of excess skin on both sides. And obviously on the right side, there is a very mild eyelid ptosis. And I would categorize that as a 1 millimeter, 2 millimeter eyelid ptosis. She does have good function of the levator muscle, which allowed me to do one particular procedure to improve it. And in this particular case, what we're going to do in her case is actually elevate the brows laterally. We're going to do that endoscopically. I'm going to go with a small camera so I can see and separate the attachments of the brow complex from the underlying structure so that it can actually move up. And we're going to keep this all laterally. I don't want to lift, in her case, the whole forehead. We're just going to do a lateral elevation just to give them a little bit more symmetry. In eyelid ptosis patients, you have to do this very conservative and after a thorough evaluation, because a lot of patients use the brows to stabilize or to lift the eyelid actually, and you don't want to take away that movement or that compensation mechanism. So she does not have that mechanism, so we are actually okay by elevating the brow. So we're going to do that. Then we're going to take and do an upper blepharoplasty with a small incision in the upper lid. The incision and the sutures are all in the eyelid crease. I'm going to remove some excess skin. I'm going to remove some of the fat pad, which she doesn't really have much, but I always find some, particularly in the medial aspect. And we're going to do a special suture to lift the levator muscle to correct the asymmetry and the ptosis on the right eye. And we're going to do this under IV sedation. This is a preoperative evaluation of a patient that presented for eyelid surgery and eyelid ptosis surgery.